All right, good morning, class. Sorry I can't be there in person, but I'm here with you now. So shut your computers down, and Robert, wake up on the front row there. I'm going to speak really quickly, just obviously on Chapter 22 and 21 in Toyota, and some of the things that I'm doing here at work, that I'm trying to do and accomplish to make the Logan Clinic a little more efficient. I'm working in my circle of influence, as we would say, I guess. There's two things that I'm working on currently. Some of you guys probably remember last class I talked a lot about standardization where I can. One of the areas I'm working on is standardizing our lab trays. This is currently, in the medical field, this is currently our lab tray for in the lab. And you can see it's not really well organized. These different straps, there's different, this is for like an adult, there's different ones for children and whatever, so this is missing a few supplies. So if I needed to have some lab work done, she'd have to go and look for some items. We are currently working on having standardized lab trays ordered so that every department will have the same tray. This is one from lab. This one should be technically in perfect condition, have everything in it that you would need for any sort of lab draw anywhere in the clinic. Here's one, I can't say where it came from, but it's not so good. Not much organization, not much standardization. I feel like this is a process that talks about in Toyota Principle 7, using visual controls and trying to standardize processes that you can do. That's one of the areas that we're working on here, is to try anything that is a repetitive task, like a lab drawing or like ordering supplies. I'm working on trying to standardize those processes for our clinic. The other big area that we're working on that relates to the Toyota way is reducing waste. We had a review once a year. A quality control person will come around and do a review on our clinic, and I'm happy to report that we didn't have any findings in that. They checked everything from expiration dates to all your machinery, make sure that you're compliant with the government, what they require. One of the things that we had a lot of trouble with in previous years was items with expired dates on them. This year we found we went for a week and went through our supply closets, every drawer in every procedure room. I honestly have to say I was pretty stunned at the results. We filled up half of my office over here in the corner with boxes of expired things. Everything that you would use in a procedure, some procedures that you definitely don't want to use expired things in, all the way down to just minimal stuff as gauze and gloves. We call that in the medical field DME equipment, durable medical equipment. That's one area where what we're doing here is trying to set par levels for all of our supplies. Currently we have two pods, if you will, two sections with 2 doctors in each section. And we have a total of 14 exam rooms and 2 procedures rooms, So 14 rooms where patients come, and then 2 where we do small procedures. And all of those rooms are different for each doctor. We're working on having par levels and standardized supplies across the board in all their rooms. One of the problems that's come up is obviously some doctors use more of certain supplies than others, and we're working to fix that so that mostly I'm trying to implement a pull system. So for example, if the gauze goes down below 10 packages, that we order one. Whereas currently it's more of a, not even a push system. We have two medical assistants who order, and kind of they order when they're told, or they order, sometimes they're proactive, habit number 1, and they'll order stuff on their own. But on certain occasions we do get a lot of things that get double ordered, so then we don't use that stuff. We had to throw away $3,000 of supplies recently, and we didn't throw it away, it went to Haiti. But all of that DME equipment or supplies was good, and that's something that the medical field has to work on, is reducing waste. And so we are implementing a system where we know exactly the par levels of everything from gowns all the way to the gloves to cleaning, all things in every room, so that it's standard. And I think ultimately in the long run it'll save us money. That process will be implemented later this year fully. It already is to some extent. All ordering now, I have to approve the orders after they submit them. So for now, what I've been doing is checking them and then going to the people who order them and walking around and having them show me how low are we, do we really need this item, can we survive without it, and of course if we need it, we order it. So between the lab process and using the pull system for supplies, those are three things that we're doing here at the Logan Clinic. I'm trying to do from our last class as well as this class within my circle of influence that relate back to the Toyota way. I think Principle 7 is really applicable to medical field. It says using visual controls to sort things, to straighten them, to shine things. All those are important to us as well as to patients, and I realize using some of these principles has really helped us out. And then to standardize where possible. You can't standardize the patient-physician relationship, but you can standardize some of the processes that are mundane and that are repetitive. And I hope that helps shine some light on what we're doing at the Logan Clinic.